provides context is that we cover almost 35,000 professionals in the country, and many of those are actually the doctors and specialists in the country. And we wanted to find out exactly, in terms of their views of healthcare in general, what their views of quality and service was like. And we started off and asked the question and had responses to about 1,800 of those professionals to say, well, what is the general view of healthcare in South Africa? And unsurprisingly, we found 70% of professionals indicated that they were quite happy with healthcare services in South Africa, possibly because many of them do access the private sector. The challenges which were mentioned were things like the management of the health services and the high costs that were highlighted. And then we moved on quickly to asking how many understood and knew about the NHI Act and all the aspects and implications of the Act. And 75% of those surveyed indicated they had a good knowledge of the Act and what was supposed to happen. Just 90% of those surveyed indicated that they didn't believe NHI would make any real difference in terms of the health systems. And so we then said, well, if NHI is not going to make a difference, which reforms did you feel would make a difference in terms of healthcare services? And going back to the context, many of the members and the people surveyed are doctors and specialists, and so have all been trained in the public sector. Many of them still work in the public sector. All of them indicated that there needed to be a more focused effort to improve both the infrastructure in the public sector, but also the management of skills and services in the public sector. So a very clear indication that the trust element between whether NHI will accomplish its objectives was in doubt.